Hello, my name is Henry Silverman, and I would like to give a short presentation regarding waiver of informed consent. What are the criteria? This next slide shows the learning objectives. By the end of this module, the learner will be able to describe the criteria for waiving informed consent in limited contact research and also for research that is conducted in the emergency setting. 2, explain the many different meanings of practicableness. 3, explain the meaning of consent bias. And then finally, analyze the balancing of utilitarian concerns against respect for persons, which is a deontological principle. Obtaining informed consent from research participants prior to their participation in research is a cornerstone for the ethical conduct of research. The principle of respect for persons provides the moral justification for informed consent. That said, one might ask whether there are types of research we can do ethically without obtaining subjects' consent. The reason to ask this question is that valuable research can be done that would be difficult or impossible to conduct if consent was required. Now, one can justify a waiver of consent if we use a utilitarian framework that balances two competing interests. One being the advancement of science to enhance population health, and the other being the protection of the welfare and rights of subjects. Now, there might be instances in which the benefits obtained from the research are great enough to justify overriding an interest in subject welfare and rights. This can occur when the research presents no more than minimal risk and the autonomy interest is negligible. With this background, let's look at what the regulations say about a waiver of informed consent. The Nuremberg Code, developed in 1947 from the proceedings of the Nazi doctors' trial, had as its first principle that the voluntary consent of the human subject is absolutely essential. The Declaration of Helsinki was published in 1964 in order to address issues not covered by the Nuremberg Code, such as research involving special populations. The Declaration states that research may be done involving individuals from whom it is not possible to obtain consent only if the condition that prevents obtaining consent is a characteristic of the research. Recognizing that important research is needed to advance the health of groups who cannot give their own consent, Helsinki gave the opinion that research with vulnerable subjects, for example, the mentally ill and children, may be done with less than full consent through the vehicle of surrogate consent. The Helsinki document realized that research participants can still be adequately protected in the absence of consent, thus allowing important research to proceed. Although Helsinki recognized the value of surrogate consent, what about a waiver of informed consent? Well, the regulations, including the U.S. regulations, recognize that there can be 3 different types of waivers. First, there can be a waiver of documentation of informed consent. Second, there can be a waiver for limited contact research. This would include certain types of retrospective records research and observational research in large groups. And the final type of waiver occurs with research in the emergency setting. A waiver is necessary in such a setting when potential subjects are not competent to give consent at the time of the intervention, or there is no opportunity to obtain surrogate consent due to the narrow time window for the administration of the intervention. The first 2 types of waiver is recognized in the common rule, specifically the waiver of the documentation of informed consent and a waiver of informed consent that either does not include or which alters some or all of the elements of informed consent. Regarding a waiver of the documentation of informed consent, full consent is given, but there is no signature. This is appropriate when research presents no more than minimal risk and the research only involves commonly performed clinical procedures, or in situations when the written signature would be the only way to identify the participant. Examples of when a waiver of documentation of consent would be appropriate include phone and internet interview studies, research involving certain groups in which there might be legal repercussions from a breach of confidentiality and hence not requiring a signature would enhance protection from legal and social harms. Finally, documentation can be a way for cultural reasons. For example, where participants might be hesitant to sign documents for fear that there might be repercussions from signing such documents. Regarding waiver requirements for limited contact research, the common rule states that an IRB may approve a consent procedure which does not include or which alters some or all of the elements of informed consent or waive the requirement to obtain informed consent, provided the IRB finds and documents that 4 criteria. 1, the research involves no more than minimal risk to the subjects. 2, the waiver or alteration will not adversely affect the rights and welfare of the subjects. 3, the research could not practicably be carried out without the waiver or alteration. And 4, whenever appropriate, the subjects will be provided with additional pertinent information after participation. Now, there are several key words in these criteria. The first key word or phrase is minimal risk. The second one is will not adversely affect the rights of the subjects. What do we mean by not adversely rights of the subjects? The other key word is practicable. When is it not practicable to obtain informed consent? And then finally, when is it appropriate to provide subjects with pertinent information after the study? Well, this slide shows the definition of minimal risk. The probability and magnitude of harm or discomfort anticipated in the research are not greater than the risk ordinarily encountered in the daily life or during performance of physical or psychological examinations or tests. To be sure, there has been much controversy regarding this definition, an issue that we will explore in a future webinar. I would, however, like to spend some more time on the concept of practicableness. Obtaining informed consent might not be practicable for 2 major reasons. One involves logistical reasons. For example, researchers conducting retrospective record reviews might not be able to locate the previous subjects to obtain their informed consent, either due to inaccurate contact information or maybe many of the subjects might have died. Now, obtaining informed consent might also not be practicable due to what we call methodological reasons or for scientific reasons. In other words, requiring informed consent might threaten the scientific validity of the research. For example, in certain types of epidemiologic studies, a complete sample size might be needed to establish the true prevalence of a disease in the community. Or there might be consent bias if the group giving consent differs significantly from the group not giving informed consent, and thus any conclusion derived from the research will not be generalizable to the whole population. Now, regarding the concept of not adversely affecting the rights of the subject, this refers to the thinking that in certain situations, not obtaining consent might represent a negligible infringement of someone's rights, or that someone might have a limited autonomy interest with informed consent. For example, one might be able to assume that most people might be comfortable with not having given their informed consent in certain types of observational research, especially if it occurs in the public setting. Finally, regarding the last criteria, when is it appropriate and when is it not appropriate to provide subjects pertinent information after the study? Well, that will depend on the research study. For example, in deception research, it is very appropriate and necessary to debrief participants after the research is over. However, in contrast, for minimal risk retrospective record research involving large number of participants, it might be inappropriate or not necessary to provide subjects any additional information after the research study is over. Examples of a full waiver includes types of retrospective records review research, for example, when it is not practicable to locate the subjects, or in research whereby the researcher de-identifies the data. Research involving observational research, and obtaining informed consent might be not practicable for reasons that we have already discussed, and this includes logistical reasons and methodological reasons. In addition to approving a full waiver, an IRB may approve the elimination or alteration of one or more of the 8 required elements of informed consent, and these are listed in this slide. Alteration or elimination of one or more of the basic elements of informed consent occurs primarily in deception research. Our third and final type of waiver refers to what is known as an exception from informed consent requirements in emergency research. The necessary criteria are shown in the next few slides. 1. Patients need to be in a life-threatening situation. 2. Current therapy is either unsatisfactory or unproven. 3. Obtaining informed consent from the participant or the legally authorized representative is not feasible. And 4, the proposed intervention holds the prospect of direct benefits to the participants. Other criteria include that the research team will obtain consent from participants or the proxy when possible. There is respect for proxy or participant assent or dissent after enrollment. There is community consultation. There is public disclosure prior to study initiation and after study completion, and there will be an independent data monitoring committee. Regarding community consultation, the common rule states the following. Consultation, including, where appropriate, consultation carried out by the IRP with representatives of the communities in which the research will be conducted and from which the subjects will be drawn. To be sure, in many instances, it may be difficult to delineate exactly the geographical boundaries of the community or which groups actually comprise of the community. Examples of emergency research include new techniques to resuscitate patients from cardiac arrest, new blood transfusion products for severely injured patients, and new therapies for strokes. To be complete, let me add that there are occasions in which the IRB may waive the requirement for parental consent. Such a waiver might be appropriate when the research protocol is designed to study conditions in children for which parental or guardian permission is not a reasonable requirement to protect the subjects. Examples include research involving neglected or abused children, and survey studies involving questions about illegal or socially concerning behaviors among adolescents. So in summary, there may be particular situations in which an IRB may approve different types of waiver. 1, a waiver of consent documentation, a waiver of some or all of the elements of informed consent, and a waiver of consent in the emergency setting. Thank you very much.